Okay.
Over to you, Ignas.
Thank you. Welcome to our session, my session, how to play with type. And I'm going to tell you something about how we use type in a master program in the Netherlands. And in the subtitle of the conference, they said using type today, using type in a complex world, using tools and artificial intelligence, and type in relationships. And I'm going to say something about 3 of those 4 things. Just type tools and artificial intelligence, I'll skip. And I'll tell you also why I skip that. And I'll start with a little bit of French. L'histoire se répète. 10 years ago, I was presenting at the BAPT in Greenwich together with Dick Otter. And that was when the university was in this building. And this building is an old monastery with, you see also the library. And it used to be my school, my high school. So I went there 50 years ago, and was there till 10 years ago, also doing together things with Dick. And we presented the book 10 years ago, You're Making the Difference, about how to use type in the classroom. The university was doing something new, and they moved to another building. And that was also a bit of recognition, because that was the building where I had my first bachelor. So when I'm teaching, it's teaching in this kind of buildings, but I also have another history. Okay, let's go and see what I'm going to say to you. I'm going to tell you something about society, something about organizations and an educational system, the gap between the systems, and what does it mean for us as practitioners, and where does type fits in. And I give you also a few examples. This is me. I'm retired professor lecturing organization and change management at University of Applied Sciences in Arnhem and Nijmegen in the Netherlands. And where is Arnhem and where is Nijmegen? Nijmegen lays in the middle of the screen, near to Germany, the red spot. And when you make it bigger, you can read a little Havana. And why is that? The Nijmegen University is always a bit contradictory to the other universities. We are doing revolutionary things, and that's why I think I like to work there. I've studied sociology, pedagogic, art history, and human resources, and I'm still working at university in civil services, and I'm self-employed. And you see, I live very near to the German border. So my question to one of the attendants, do you speak German, was slightly the hope we all could speak German, because that's easier for me than to speak English. But okay, I'll do it in English. We live in a VUCA world, and we are training people to work there, but it's moving all the time. And also I work with nurse practitioners. They are also in a very, very VUCA world. The only thing they really can depend on are the old familiar things that keeps standing still, like these long tails, these boats. And they have to stand it. They have to live within that world. And in the old world, society and organizations were all central, were top-down organized. were big, large organizations, were with all kinds of systems and structures, and much of them were rigid and fixed. But in the new world, we see lots more things are decentralized. Much is going bottom up, all with small networks, where people and initiatives are more placed central within the world, and it all gets fluid and flexible. And then it's very, I call it, a world where you have, when you are a nurse or nurse practitioner, you become anxious because where do you stand? And that's where we are now, in that tipping point. That's where we are. That's where we see that our society is changing. And we are going to an horizontal organized, decentralized, bottom-up organized society. And I always like the things Robin is doing on these conferences, because he's also does a bit of magic he brings. And I always use in my lectures these things. These are poles, but they are tippy tops. And if you're turning them, they tip over. And that's what I like about this slide. We are going from one organized situation, organized society, to another one. And that changes people. People have to do something else. It's a paradigm shift. It's a fundamental change in an individual's or society's view of how things in the world work. And, you know, in the 50s, we had the vicar and the priest telling us how to do it. And in the 60s, 70s, their role was taken over by the doctors. And I come a lot in hospitals, visiting my students, and I still see doctors of my age and having that same feeling. We know what we want to do. And then then the bankers came. The money, always money driven. And yes, also the lawyers came in 20 years ago. And for you people who don't know a few of these Dutch people I'm having photos of, they're all wrong persons. We have the wrong banker, we have the wrong lawyer, we have the wrong doctor, we have the wrong vicar, and we are changing. We have a paradigm shift, and now you are going to be more significant. You have a significant role to play. And about you, I mean the professional. And you see that the paradigm is changing from church, where the vicar and the priest, and the measure of things were the Bible, to cure, geneeskunde, cure as a doctor, and evidence or effect, money, banker. And you see it's moving. And yes, the customer is going to be the paradigm. The leading figure is becoming the professional, and the measure of thing is the customer and the values. We are going to grow to a value-driven society. So it changes. I don't have to ask you who won this game, but yes, paradigm shifts. And one of the things we see that in the new paradigm, we go from exploitation to cooperations, from structure to humans, from deriving values to creating values, from linear to cyclical. So in this world, we are learning to our students to behave. And where in the old paradigm, we had the 5 P's: politics, pecuniary, pence, pounds, spoon, and pennies. We also have in the new one, the 5 P's: people, planet, profit, pleasure, and passion. And this change makes that we can't rely only on the academic context. We have to learn people to act in a societal context. We can't rely only on the disciplinary they are acting. We have to make them working in a transdisciplinary world, heterogeneous, society accountable, and not from problem solving, but to problem finding. This was also 10 years ago. And when I was acting at the university, we were confronted with this movement, and we said we have to change it. We can't rely on giving people only the books and giving them lectures about how they are going. They have to do it, but we have to learn them to survive in that VUCA world. And we were still working with the traditional system, so we had to change it. And when I look to the classroom of my grandchildren, I still see this system, but okay, we had to change it. So we did change it. And do people notice it? Yes, people notice it, and we are we have an accreditation a few years ago, and we were top rated in the old building. And we did have another accreditation last year, and we are again top rated at the University of Applied Sciences in the Netherlands. So what do we do? What makes it so special? Do we do something special? No, we don't. We changed a few things in our program. These are our master students, working professionals, aged 25 to 55, working in care, cure, and education. They are working for at least 2 years. They have a bachelor degrees, they have responsible jobs, and I work in the Master of Advanced Nurse Practitioner, the Master of Musculotale Revalidatie, Master Neurorevalidatie, and a few others. And we changed a few little things. And one of the things we do is, this is a program, a study program. Don't try to read it. But the key elements we introduced is that knowledge is patient-centered, evidence-based, practice-based, multidisciplinarity, and you have to act, you have to perform with behavior and attitude. You have to do things, implement things, knowledge, but also change or growth within works. You have to demonstrate leadership, and you have to be authentic. So when I watched Roy Childs in the hour before me, I loved it, because that's also the thing he was telling. He was telling to be authentic. And yes, we also use type. We use type to speed up learning processes, because we have done the students 2 years, 3 years in a dual learning situation. And we learn them to look through different lenses. Use all kinds of lenses, but they have to make their own choice. So we changed the curriculum and introduced type 15 years ago, and it still is. And 10 years ago, we only had type at the beginning of our program, but during the last decade, we make it more broader, and also using all kind of didactical and pedagogical other things like Miller's pyramid, from knows to knows how, shows and does. We also are using Bloom's taxonomy. I'll also make sure you'll get the PowerPoint. We also are using Gardner's theory of multiple intelligence, and we are combinating them. We are playing with them. And the 5 stages where type is present, the 5 stages in the curriculum, is at the introduction, at coaching, at a learning unit, calling implementation plan. Another one is the learning unit role development. And at the end, at research and master thesis. And I'm going to tell you how we're using it. And yes, I'm using it at the introduction at several points in the program. And we start with the introduction. They start all with the questionnaire, digital, followed by a workshop. And I give you the disclaimer of type and the main message of the type. And let's see. The instruction when you have to fill in the questionnaire is, like Roy Child said it, with your easy boots on, or something he called it. Do it at home when you feel well, when you have feeling, when you're in your comfort zone. And our main message is not this one, because in type is when people are saying type is a diagnose model, they overlook the word know in diagnose. It says know. It's not like the Enneagram. It's not like the Big Five. It's not like what did Roy Child say, NIA, OPQ. No, type is a dialogue model. So we use it we introduce it not as a diagnose model, but as a dialogue model. And so we say you start with something and you grow during the 4 years. You grow into your own, you grow to describe, to be able to describe your strength, your weaknesses, your person. So what we are doing is giving people stuff to talk about. So when we start our type program, when we start, when I've had all the questionnaires coming back, we're going to have a workshop. Never mind, I do a workshop with 75 till 80 people at the same time. It's always fun. And the type disclaimer is, it's okay. And it's not about you. So all the things I'm telling you, it's not about you. And yes, when I'm telling about somebody in a he form, it could also be she. When I'm telling something about she, it also could be he or it. It never matters. And yes, I'm going to tell you things that are, in Dutch it's called spierwit, extra white, till gitzwart, deep black. But since a few years, we know that between the extra white and the deep black are at least 50 shades of another color. So this is the disclaimer. Here we start. It's okay. It's not about you. I only give examples, and find a nuance. Go and play and look for where you are. And one of the nicest things is that, having said this, people are going to talk about themselves, because they always can say, it's not about me. So we create a very safe environment. And that's the main issue. It's not about you. In the workshop, they have a complete questionnaire at home. They have an interactive workshop in an afternoon, at least 3 hours, making up the self-score, checking the outcomes of the questionnaires and the workshop, and they got a description on paper. Yes, I'm sorry, my fellow practitioners, we don't give it digitally. We give them on paper. And they got a booklet with all the theory and all the types in it, and they get it on paper. In a map like this one, when it's my company, and when it's from the university, you have the logo of the university, is this map. And yes, we said, open up new horizons. And they got a description, and it's 11 pages of text. And they also have an instruction. Use a highlighter, use a pencil, and use stuff like this, and make it your own. Make it your own. Scratch away what isn't right. Highlight what is okay. Write extra things to it. And the nice thing is what's going to happen is, when we give it on paper, the students are bringing it. They're coming once a week to the university. They are taking it with them every day. They're coming to the university for 2 years, and they are going to use it with evaluation talks with their boss at home. They're talking about it. So yes, they are using it as a dialogue instrument. And the second stage we're using it is when we are introducing coaching. They get a supervision in guided groups, and they are putting together with different temperaments. And the nice thing is, when we did it a few years ago, we use coaching, but also case studies during coaching. When we bring in cases, they were solving the case. But now they are talking about the case and asking one another, why do you make that choice? Why are you doing that? Why do you do this? So it isn't important to solve the case. It's important to, and Roy Charles said it, it's important because they are learning to listen and to disagree as well. So they are learning by exchanging the things. Like we also use them at the introduction and the workshop. They are exchanging thoughts like BAPT and Ernie. And yes, when they're talking in these groups with different temperaments, people are saying to one another, you just act like Ernie, or you're just like act like Bert, and people accept it. So yes, what we achieved is that they are learned to exchange, to agree and to disagree, to exchange different points of view. And supervision goes to intervision, goes to a knowledge circle, and they are constantly writing their own story, but also describe their own curriculum within their situation. And we learned them that learning is something you don't do alone. You can't learn when you're sitting alone in the lecture room. So when we are in the learning unit of implementation plan, they get a guided discovery of their organization. They discover types, dynamics between stakeholders, having also the use of using the 16 types or 4 when we go to the temperaments. And we know them that the student self is the most important tool. And they have to rely on it. So they learn to rely on themselves. They learn how to present. They learn how to act. And that's the same in point 4. They learn how to survive within an organization. And surviving within an organization means you have to drink a lot of coffee with a lot of different people. They learn how to profile themselves as a professional, how to play the strategic games, and how to become a partner in crime. So that's why we teach them to go around and move within the organization. And one of the assignments they have is make an appointment with your boss. And yes, I'm proud that I can tell you that since 10, 12 years ago, at least one student a year makes an appointment and gets an appointment with the minister. And yes, the minister is willing to talk with them because they have something to say. And one of the paradigm shifts was from top down, going bottom up. So they are doing it. And then we pick it up, and we go to a further development of type. Know where to stand for, be different, act different. So take care that you got noticed. And yes, it works. And in the last part of the study, we use the Z model. Discover blind spots or types as a guide to prevent pitfalls. And you know, this is a master thesis. If you have the Z model, you first gather a lot of information, S, place it within a bigger theory, a bigger model, then test it, get a search on it, whether the theory is right, and then place it, make it valuable, place it within an organization and give it extra value. Take care that people accept it. And they use it. They use it with all the things we give them. And yes, 10 years ago, I got at Greenwich a lecture from, I'll give his name another time, and he gave us the questions, and we still use them. Sterling Bates. And yes, we use them. We use them to let them watch the other side. See things that other people don't see. Make the difference. Do it. And have fun. Do it the other way around. The Scots still lost, but not as bad as the Japanese. We learn them to work together, effective and creative. We want them to be like this sum, 1 + 1 is 3. And we want them to do it together. Learning that there are multiple ways to get there. That you are not, that we as lecturers, that we as professors, we can't describe the right way. They have to choose where they want to go to. They have to make the right connection. And yes, I can tell them you have to connect with that surgeon and you have to do that and you have to do that. But I can't tell them how to connect with that type of surgeon. So they have to find it out themselves. And that's the way we use type, to let them play with all kinds of different situations. And always using multiple points of view, always using dialogue to get there. And there are multiple ways of telling it, but you have to pick out that thing to tell that really gets to people, that really make people feel what you're doing. But be honest. Be honest. Never tell a lie. You have to be honest. And you know, this guy, he's going to get more than when he had something else on his board. And there are also other ways to tell it. Just watch.
What did you do to my saying?
I wrote the saying, but in different words.
Thanks, love.
And this is the same message we gave them when we gave them their personal report at the first workshop. We're saying to them, change your words. Make it your words. Change your world, make it your world. And yes, it works, it works. For example, we had a nurse practitioner working with children who have cancer and have their chemotherapy. And when you have chemotherapy, they have to go to the hospital every 4 weeks. And when you're living not next to the hospital, it took the children a day to come there. A day to come there, yes, because they had to go with a taxi, and there one of the parents go to the hospital, have all the checks there, the waiting, having the chemotherapy, and then coming back again when the taxi is available. And so they took it. They took away. They took a day for one session. And one of our nurse practitioners said, "Why can't I give a chemotherapy at home? I can create the same circumstances as in the hospital. I can also measure the blood pressure. I can take blood. I can do it in a sterile environment." And because he was giving enough arguments to the doctors, they allowed her to do it, to alternate it. Okay, they said, "We're going to give you the benefit of the doubt," I believe it's called. So she could go to one child 1 month at home, and then the other month the child has to come back at hospital. And they made all the same checks at home as they made in hospital. And blood pressure at home was lower. The time of consuming for the chemo was a fraction at home as it was when she had to go to hospital. This time she got it within at home in a safe environment. They also could invite people to come over to watch, so it became more normal. And yes, she got the permission after a study presenting the benefits of it. They got her the permission to do it outside of the hospital, at least alternating it. So one time in the hospital, one time at home. This was her project. And yes, it's spread out over the country. Another one is about sleep apnea. A lot of people are having breath stops during the night, and you can fix it with not not so ugly as it looks like in this picture, but people are going over to an hospital to have a training. First, to having diagnostic session, and the second one is to learn how to sleep with this kind of breathing instrument. It's called the CPAP. And people were called for a training 2 at a time. And there was a lot of no-show. And one of our nurse practitioners said, "Okay, but I also want people to engage with one another. So if I can get a small group and let them talk to one another about how the feeling is, and our role becomes smaller, and they're more self-supporting, becoming groups that are learning how to act with such a breathing device themselves." So they didn't invite people with 2 anymore, because when 50% doesn't show up, they only had 1, but they invited 4. And instead, when you invite 4 people and 50% doesn't show, you will still have 2. And but they had a lot more people, because it became the waiting time became also shorter. They started to form app groups to one another. So when they had a question, they questioned one another instead of go to the doctor or go to the nurse practitioner. And the treatments were going, the way they were acting within the treatment were going up. Showing more people at the training, the therapy, the loyalness to the therapy grew, and the effectiveness of the positive effect on the health of people grew. So this was not a medical nurse, but it was somebody who works with, how do you call it? Psychic patients. He introduced it there, and it works. It works still now. And so lots of people sleep a lot better. And they also make pathways to communicate to patients, to discuss what kind of therapies they want, with all the benefits, with all the harms, with all the risks. And this is not done by doctors, but done by nurse practitioners. So they are taking over. And the next one is that we have 3 nurse practitioners who are going to take over a practice of a general practitioner. And they're going to hire a general practitioner within it, because they say, when we see at the cure and care landscape in the Netherlands, we see a movement of demedicalization of problems. So when we demedicalize our treatments, we need less doctors to act. So all these nurse practitioners who have the socially and the medical knowledge become more involved. Or in the elderly, people are more allowed to die at home. They make it possible. Also because they say, when we have a value-driven organization, if we have a value-driven society, we need to give people also that room to do it. So, yes, we give our students a lifelong learning. Self-directed, continuous quest to seek formal and informal education for personal enjoyment or develop career skills. And the key elements: personal profiling and strategic positioning. Always be aware of those 2 things in what you're doing. So they're not navel gazing, they are looking outside, they're looking for chances, they are looking for what is going to happen in society. How can we help? How can we develop? How can we contribute to what we want to do? Okay, the courses. Yes, high rating. Yes, we see visible personal growth. We also see that students take the maps with the personal story, their personal profile, their type, take them with them. And we see successful projects and implementations, patient-centered, value-driven. Are we there? No. No. What I see is that we still need a lot of research on professional leadership, applied leadership. And yes, we still need a lot more of case studies on type and how can we organize learning processes most effectively. Because we are playing with it, I'm playing with it, I have 2 colleagues also playing with it, but there are a lot of people saying MBTI or GTI, we use GTI, but MBTI is a test. No, it's not a test. It's a dialogue instrument. And we have to change it. And we know when we're working with it with our students, we are able to change it. But it is a long way, and I'm curious what's going to happen. I told you I'm retired. Yes, I'm still acting at the university. Yes, my last session there was yesterday, and the next one is going to be next week. But I don't have a good feeling when I'm away, because I don't see a lot of people adapting the worth of using type. Yes, the one whom I'm working with are infected with the virus, but it's very, very difficult to get it spread out more. So my ambition is to give a legacy to you and to all of my colleagues to do more with type. But like Roy Childs said before, you have to start a dialogue. Keep talking about it. Keep working on it. You're never ready. And we never say to people, you're our, I see here Claire says ENFP. No, in this situation, in this state of mind, that is perhaps your best type. But in another situation, you are able to change. So yes, play with type. Take care that when you have, and all my students get one of these tippy tops, when you're playing with it, when you give energy to it, it turns around. So if I see Lila saying ENFP, when it turns around, it could be ISTJ. So play with it. Allow people to change, allow people to grow. And yes, the nice thing is, when we have a meeting of alumni, people come to me and to my colleague and they say, oh, I'm still using it. Are you able to come over? So yes, we are visiting a lot of small and larger groups of people and introducing them to type, but introducing them to a way of living, a way of behaving, a way of talking about, keeping in dialogue about themselves within and with the other. Viv, I managed it within the hour. We still have a few minutes to answer some questions. I hope it gave you a bit of an insight how we are using type within the university, giving not only the tippy top to people, but also the one to highlight the things you want and to make corrections, not with a pen, but with a how you call it, a pencil and gum. So keep changing, keep playing, keep fine-tuning it, and have a lot of fun. That's our message. That is what we want to do with people. And yes, I wish it to you. Make fun with it. Questions? And I'll go to the chat.
Nothing in the chat. Which of all of your techniques did you use was the most successful to engage your students to keep type alive?
Okay. One of the things I'm using, I also have, I stopped sharing this. One moment. Oops. one of the things we use are also books. Change as playing together, a positive view on changing and renewing organizations. But I start my lecture, and I do it now for about 4 years now. I start my lecture asking my students to congratulate their neighbor. Shake hands, congratulate him or her, because you've got it, you've done it, you have made it. And then they look at me, why? And we say, you've made it. You're going to have a good point for this this part of the study. So pull out the plug of having the pressure. Don't pressure them up, but make it pleasurable. And then they're free to act within their own organization, because I can only see them for a small amount of time. And 95% of the time they're acting within an organization. So I have to give them freedom of speech, freedom of act, and just give them enough power to go to the next step. And you know, Viv, when you ask a nurse practitioner to go to the chair of the organization or go to the minister of Holland, the first thing they say, are you crazy? I can't go to him or her. What do I have to say? And when you say, but don't be shy, ask what kind of development he or she sees within the field you're acting. What do you think about developments within the fields you're acting? Then they start, they all have their ideas. And then they know people are interested in them. I was a few months ago at the National Care Authority here in the Netherlands. It's something like the NHS in England. I was at a board meeting, and they said to me during the discussion, we have a lack of ideas. And I said, pardon? And they said, yes, we have a lack of ideas. And I said, oh, do you want to have 75 a year? And they said, 75 a year? I said, yes, I have 75 students every year, and every year they have great ideas. At the end of the talk, they said, yes, we want to get knowledge of them. Because what they are doing within patients, with customers, at the working floor, at the daily madness of it, they really have important information that never comes upwards. And when they say we want to change things, it's most of the time very worth a lot. The nurse that makes it possible that children get their chemotherapy at home. It's marvelous. She made a film of it. And I've seen the film 25, 30 times. And every time I see it, I get goose skin. I get tears in my eyes. And I'm a thinker. I can step outside. I can't step out of it, because when I see what value it gives to that child, it's unbelievable. So, yes, the thing we do is get away from the pressure, give them room to act, give them room to react, and give them room to grow. And I told you before, Is it made possible within the Netherlands to say in advance you have passed the exam? No, but I have a special position within the university. I was for a very, very long time chair of the exam committee, and yes, I'm confident I can tell it. And yes, we see better products giving people the room. So
It's incredible.
be friendly. Give people grow. Let people grow.
Yeah, on that note, Ignas, thank you so much. The hour has absolutely flown by. Thanks for you joining. Our next session is at 3:30, and you've got two choices on the stream. So the first is making and keeping type part of the conversation with Sharon Lavoie. And the second option is with Mina, and that's seeing the garden, psychological type, and EMDR. So hope to see you all at 3:30. And thank you so much, Ignas. Really, really interesting. Thank you very much.
Okay, thank you.
I'm going to stop.
Thank
Bye-bye.
you.
Thank you.
Bye.